This is my neighbor, my brother, sister, grandpa, and grandma. Okay, to be a nurse, it is very important to have great communication skills. These communication skills include group communication, listening skills, and interpersonal skills. For group communication, it is very important because at a hospital you have different departments that you need to communicate with. You have ER, which usually is where the patient comes up from. If the nurse will usually call with report, and if that nurse forgets to call or gives the wrong report on the wrong patient, then you're not going to know how to take good care of the patient. You have lab, which usually will call about a critical lab, and if they forget or do not call, for several hours on that critical lab that you need to know about right then and there, then that also reflects on the patient's care that is going to be given. You have housekeeping that cleans the rooms, and if they don't clean a room or they say that this room was clean and they meant this room and the patient is admitted to the dirty room, then that patient is brought up, they're going to sit there, they're going to see that the room is dirty, and they're going to wait for housekeeping to come up, and then housekeeping will have to clean that room while the patient is there, and that just reflects on not good communication skills between the different departments. And then you have to think about the patient as a whole. If they have a bad experience at the hospital, then they're not going to want to come back to the hospital. They're going to go to a different hospital, so they will think that they'll have a better experience. Then they'll go home and they'll discuss their experience with their family members and friends, and then they most likely will want to go to a different hospital because they're not going to want to receive the same care that this patient has received. Then you have interpersonal skills. For interpersonal skills, it's very important because you want to make sure that the patient feels like they are at home. You want to go above and beyond your work to make sure that you meet the expectations of that patient. You're going to want to remember their names. You're going to want to remember their family names so you can address their family by their name when they're coming and going. These skills also include being very caring, being very sympathetic to your patient. You need to be very responsible as a nurse because you're responsible for your work, you're responsible for the patient's care, and you're also responsible for your nurse aide. And you need to be very detail-oriented to be a nurse. You need to be able to direct or supervise others. That goes back to the nurse aide. You need to make sure that they're doing their work and you're directing them in the right care that they're going to give that patient. You want to correctly assess the patients because assessing the patient is very important, because if you assess them wrong or don't catch something, then that goes again towards their care and they're not going to get the best of care that is needed. And when you're assessing somebody, you need to determine when a consultation is needed as well. And if you assess them wrong, then you might get the wrong consult for that patient, and then again, they're not going to get the best care that is needed. And you also need to be very emotional stable because every patient is there for a different diagnosis, and it's very hard on the family members of that patient. Some patients' families know how to deal with stress, and they know how to cope with the stress, and other family members don't know how, so you need to be able to cope with the situation that's going on, and you also need to help the patient's families that are trying to cope with the stressors that are going on in the hospital as well. And you also need to have a good rapport with your coworkers, and because if I'm having a bad day or if I'm not getting along with my nurse aide or vice versa and we're in a room, the patient's going to be able to feel that tension that's going on with us, and it goes again towards their care, and they're not going to get the best care that is needed. And when you have a good atmosphere, a good happy atmosphere, then that patient is going to get better care, and it's going to help with the healing process. And then you have listening skills, which is the most important communication skills as a nurse. It includes speaking as well as listening. And you should be able to openly talk with your patients and their family in order to understand their needs and expectations. You want to be able to explain the treatment given to the patient, and you want to know exactly what you're talking about when you're talking to this patient about their diagnosis and treatment. And it's very important when the patient is admitted and you're doing that first admission assessment, you need to know, you need to really listen to them and hear word for word what they're telling you, because that goes for the whole care of treatment that they're going to get at the hospital. And if you miss that critical word of why they're there, then they're not going to get the best of care that is needed for that patient. If you're not listening, then you can miss so much information that the patient is trying to explain to you, and again, they're just not going to get the best of care. And for a nurse, you give report to another nurse, or you receive nurse, and if you receive report from another nurse, if you're not listening while you're getting report, then that goes again for the patient's care, and vice versa. If you forget to tell a nurse about something critical, then they're not going to give the best of care to that patient. And for example, if I tell a nurse that this patient has had critical labs, but the doctor doesn't want to be called until it gets to this certain point, and then they didn't hear me, and then they go through their day, the lab calls with a critical lab, the doctor has specifically said, don't call me about this lab, and then they decide to call, then that interrupts the doctor's day with his patients that are at the office. The doctor is going to get mad at the nurse for calling because he specifically said, do not call me unless it's this value. And then it just goes back. The nurse is going to have a bad day because the doctor yelled at the nurse, and then everybody's going to be upset because they didn't listen. So to be a successful nurse, you will need good group communication skills, good interpersonal skills, and great listening skills.